Dr. Couto is a name synonymous with Greyhound Health and medical research. His legacy lives on in the Greyhound Health Initiative. We welcome him and Mandy Albert, Executive Director of the Greyhound Health Initiative, next on Greyhound Nation. This is Greyhound Nation, Episode 49, recorded March 6th, 2025. Dr. Couto and the Greyhound Health Initiative. Greyhound Nation is a podcast for Greyhound enthusiasts produced by Greyhound enthusiasts. To learn more about our show and its hosts, visit our website at greyhoundnation.dog. That's greyhoundnation.dog. Hello and welcome to another episode of the Greyhound Nation podcast. I'm Michael Burns. Now, here's your host, John Parker.
Welcome back, Greyhound lovers, to the best Greyhound podcast in the world. We're featuring on this episode the Greyhound Health Initiative with two of its principals, Dr. Guillermo Couto and Mandy Albert. Welcome, folks.
Hi there. Thank you for having us.
Dr. Couto, let's everybody, I think, except maybe three people in the Greyhound world may not know you. You're kind of the veterinary guru, one of them, of the Greyhound world, particularly the retired Greyhound world. So let's turn to you first. And for those that might not be familiar with your background, tell us a little bit about where you're from, where you received your veterinary education, and how you got focused on greyhounds.
You bet. Yeah. So, I went to vet school in Buenos Aires, Argentina, and had a solo small animal practice in a very small neighborhood right across from my parents' home for about 3 years. Then I hired an assistant, and I always wanted to learn a little bit more about internal medicine and cancer medicine and blood diseases. So 5 years later, I ended up going to UC Davis to do my residency. So I did an oncology residency, and then I became boarded in both internal medicine and oncology. And I always jokingly say that the biggest mistake I ever made in my life was to adopt Clyde. That was my first greyhound, and it was 30-something years ago, because I decided that Clyde just looked like a dog, but it wasn't like any dog I had ever seen before. So then I started looking into, okay, so what is different in these greyhounds from other dogs? And then why are they different from other dogs? And then, what are the genetic reasons behind them being different from other dogs, and so on and so forth. So that led me to, I always say jokingly, if I had adopted a lab like I have now, I would have probably played golf or done woodworking or a number of other things. But instead, I spend most of my free time trying to understand this long-nosed dudes and dudettes. And it's funny because like 2 weeks ago, I was doing a lecture and somebody was asking me how many publications did we have on greyhound or sighthound medicine. And we had 41 peer-reviewed publications that basically is 95% of the publications on internal medicine or hematology or cancer in greyhounds. Most everything else is orthopedic. So I did work at Ohio State for 30 years, and we had a great program. We actually had a not-for-profit organization, so we had a lot of donations that would come in and they would help us care for sick greyhounds. So we had a really good combination, because people will bring their greyhounds to us who probably knew a little bit more than the average vet about greyhounds. We would frequently solve the problem, and we would do so at our expense, which, basically everybody wins. And in the process of doing that, we will generate data that will allow us to then share that with, veterinarians and owners and adopters throughout the planet. So it was great. So that's, we'll tell you a little bit about how GHI came about after I left Ohio State, but that's sort of like the long and the short of it.
So it was basically those lab differences, those blood chemistry differences that got you kind of hooked initially on the greyhounds.
I tell her not only that, but actually the first day I did a physical exam, I went like, wait a minute, why does he have a heart murmur? Why do his lungs look different on x-rays? Why does his heart look different on x-rays? And why does he have that humongous spleen, And in the old days, before we started doing greyhound medicine, and you probably know this, John, but a lot of greyhounds will go to the vet because they were not doing well, what we call the ADR, ain't doing right
Right.
deal.
Yeah.
And they will take an x-ray, they had this giant spleen, and then the vets will take them to surgery and yank the spleen out. And we were going, well, this is no different. If somebody has a giant nose, you're not going to go cut their nose off, just let them be. Their spleen is a functional feature. So yeah, we spend a lot of time, working with cardiologists and hematologists and exercise physiologists and hemoglobin chemists and lots of different things. So it was really really cool because we got to answer questions and we got to help people around the planet with things that people used to think were abnormalities in greyhounds or sighthounds, and then they discovered that they were just the way they came out of a factory. So
Yeah. What were most of the greyhounds that you dealt with former racers retired, or did you work on some active racers as well?
yeah, I tell you, good question. So for a long, long time, I would tell you maybe close to 20 years, they were primarily retired racing greyhounds, and industry and academia did not play well together in those days. So we started doing outreach activities at the Wheeling, West Virginia racetrack, and we would go primarily with sponsorship from either private donations or IDEX laboratories. And we would look at a couple of hundred greyhounds and do lab work in all the dogs and then share the results with the trainers and the owners and the handlers and so on and so forth. And after doing that a couple of times, then we started working quite a bit with the Wheeling racetrack. And we reached a point where the trainers would basically reach out to us, when they had a problem, which was awesome. I never thought that was going to happen, but it did. So in the process, a lot of dogs got better, and Wheeling has a veterinarian that is the strongest advocate for the greyhounds. So basically, no greyhound can be euthanized in the racetrack. They have to be relinquished to Dr. Bohenko, and she's the one that makes the decision as to whether this is a treatable condition or not. So we did work quite a bit. We published a few things on exercise physiology in greyhounds too, which was really interesting.
What did you also teach at Ohio State? Were you a professor?
Yep. Yeah. So I was a professor. I was the head of the hematology and oncology service for 30 years. And so I do primarily cancer medicine. And, because greyhounds have such a high incidence of cancer, greyhounds, literally 2 out of 3 former racing greyhounds will die of cancer. And probably anywhere between 25 and 30% will die of bone cancer or osteosarcoma. So we had an opportunity to contribute there. We had a huge research program with Nationwide Children's Hospital looking at osteosarcomas in the greyhound as a model for pediatric osteosarc. So we got quite a few publications out of that. Osteosarcoma, as you know, is very common in greyhounds, as I was saying before, and in children, it is the 8th most common pediatric tumor. And even though it is a quote unquote common tumor, there is less than 500 children a year diagnosed with osteosarcoma, as opposed to about 25,000 dogs a year diagnosed with osteosarc. And the biology is practically identical. The genetics, the behavior, the response to treatment, the imaging, everything else. So we were able to, for lack of a better term, sell the concept that uh, dogs and greyhounds in particular are a good model for understanding osteosarcoma in children. So we did a lot of stuff with their geneticists and their pediatric oncologists and stuff. So it was very cutting edge, exciting stuff.
Did you find that it was kind of a two-way street between the humans, the children, and the greyhounds? In other words, is what you did with the greyhounds helpful with treatment of child osteosarcoma, and then vice versa?
Yeah,
What you found out with treating childhood osteosarcoma helpful with the
yeah,
greyhounds?
yeah. I tell you, it's a little bit different beast because veterinary oncology is very, very different from human oncology. So remember, in human oncology, your goal, if at all possible, is to cure the patient, and you know that the patient is going to have a high probability of moderate to severe side effects, and that is part of a package. But in dogs and cats with cancer, quality of life is the number one issue. So to use a vernacular terminology, we do not hit dogs and cats as hard with drugs or radiation or immunotherapy as they do in people. And to be honest, kids with osteo do significantly better than dogs with osteo because they treat them way more aggressively. They treat them with drugs that no normal human being will accept on their dog because of the side effects. So it's very, very different. However, when we found the gene mutations, we found them before they found them in kids. So that led them to pursue those approaches. So
Did you find in humans that it takes the osteosarcoma takes the same pathway? We all so often it goes from the limbs to the lungs. Is that the case in humans as well?
yeah, and in dogs and greyhounds, it's a little bit different. If they have undergone amputation and then they receive chemotherapy, quite often they end up in other organs like the kidneys and the liver and the muscle. Whereas if you do not expose them to chemotherapy, literally 95% end up in the lungs. So the chemo changes a little bit the biological behavior, but there's good stuff in the horizon. We were just talking with Mandy yesterday. Dr. Nikki Mason at the University of Pennsylvania just started a study on dogs with metastatic osteosarcoma, that has spread to the lungs. So I'm really excited to see what that can do.
One of the arguments I hear from time to time whenever there's a discussion on Facebook, somebody's dog has just been diagnosed with osteosarcoma in a leg. Question is whether to amputate. You hear arguments on both sides of the issue. You don't get enough time. Whatever time you get is precious. What are you finding now is kind of the median time you're getting with amputation and chemotherapy after diagnosis in terms of longevity?
Yeah, I tell you that I wouldn't use the term funny enough, but funny enough has not really changed radically in the last 20 something years. And if we only amputate a leg in a dog with osteosarcoma, the typical survival time is about 4 months, 3 to 5 months, but 4 months, literally 16 weeks is usually the magic number. With amputation and chemotherapy, most of the dogs will do well for a year to a year and a half, but there's about 10% of dogs that will come out of remission very, very early, and about 10% of dogs that will stay in remission for over 2 years. We've had quite a few greyhounds that had survived more than 2 years after osteosarc amputation and chemotherapy. So, and it's a very personal decision. There are some owners that feel that if they were to discuss this with their greyhound and tell them, we're going to take your leg off, but you're going to spend another year and a half with us and enjoy life, they will sign on the dotted line with the other leg, obviously. But there are other people that say this is unacceptable. Why would I put my dog through the trauma and put ourselves through the expense if he's going to be with us for only a year? So it's a very, very personal decisions. As oncologists, actually sit down and spend a long time talking to the families about what is ideal for their situation. So and again, in kids it's very different. They cure quite a few kids with osteo, but they do aggressive surgeries. They preserve the limb. They are limb sparing surgeries that work really well in kids. They don't work as well in dogs. And then, as I was telling you, they treat them very aggressively with chemo. I had two of my former students that were osteosarcoma survivors, and they were telling me the horror stories of what they went through, and it's just no dog family in their own mind will go through that with their dog. It'll be just impossible.
Yeah.
Yeah,
Yeah.
there's actually, not to interrupt, but there's a PBS special coming out on May 5th. From Dr. Nicola Mason is on that PBS special, and they talk about they're going to be talking about the relationship between greyhounds with osteosarcoma or any dogs with osteosarcoma and how they're transferring that over to human medicine to try and fight it. And they actually have a 20, I think she was 21-year-old patient who lost her limb to osteosarcoma, a human patient. And she talks about her journey through that. So it ought to be a really good show. I think, to watch.
You know the title of it, Mandy?
You know what? I don't know that they gave me the title, but they did give me the trailer, so I could always send you the trailer and you could put the
Yeah,
link.
that'd be great. We could
Yeah.
use that in the show notes and give
Yeah.
everybody a heads up
That's
on
great.
it. That'd be
Yeah, we
Yeah,
plan
and
on posting it on our website as well, so that everybody can
excellent.
watch it.
yeah, and the other thing that I was going to mention, John, is that I don't remember exactly how long ago, but maybe about 15 years ago, the National Institutes of Health founded the first ever comparative oncology group. So basically, there's a large number of veterinary schools and specialty veterinary practices that contribute to a biobank. So whenever a dog has an amputation for an osteosarc or the spleen taken off for a hemangiosarcoma or they have lymphoma or something along those lines, those tissues get banked and they get banked with serum and blood and urine and normal tissues around the tumor and so on and so forth. And all that has been used primarily to guide treatment for the same tumor type in people, in addition to doing it for dogs. So that's been going on for quite a while. So comparative oncology is one of the things that actually made me really happy when I was in academia, because we
Yeah.
could do this and then help two-legged people, you know.
Hmm.
How far are we from a genetic test for breeding stock in greyhounds that can tell whether they carry and may pass on a gene that makes osteosarcoma in the offspring more likely?
Yeah, I tell you, I think, osteosarc, like most other cancers, is a multifactorial disease and it's not a single gene disease. So there's, several things have to happen in order for a dog to develop osteosarc. But I think that before too long, it will be easy to test. But here's the problem. And, about 15 years ago, we were working with the epidemiology group at Nationwide Children's Hospital, trying to look back at pedigrees. We look at, I can't remember, 200 osteosarc greyhounds and 300 healthy age-matched control greyhounds. And as you well know, there were 3 or 4 really good studs in the 60s and 70s that sired most every greyhound that is around today. So people talk about bloodlines with osteo, and we do. I've seen 3 litter mates in the same litter with osteosarc, so we know that that happens. But the biggest questions in my mind are, if the testing becomes available, will there will be a lot of financial interest associated with it, and I tell you, one of the theories that we had with the folks at Children's in Columbus was that osteosarcoma genes are either high performance genes or they live next to high performance genes. So if we're going to continue raising greyhounds, it's quite likely that those genes are going to be very close together, and you will have to decide, do I want a slow greyhound that doesn't develop osteosarc, or do I want a fast greyhound that has a higher risk? I think that that's probably what is going to happen. But there is a lot of really good stuff going on now on genetics of osteosarc, and I am working with a group that is actually looking at a blood test for osteosarcoma, and still needs to be validated. We're still looking at sensitivity and specificity, but this test actually theoretically could diagnose osteosarcoma before the patient is lame. So you could actually run this test in at-risk groups and hopefully catch them before they are advanced. The question is, will that change the outcome? And we don't know that. We're just literally. I just had a meeting with this group yesterday, and we are starting at the end of a month collecting samples from osteosarc greyhounds and healthy greyhounds to see what we get.
Do you think the genetic test will come in human medicine or veterinary medicine first?
If you look at the money invested, you would have to bet on human medicine because they invest billions of dollars in tests. But the truth of the matter is that there are still no blood tests for cancer that are approved by Medicare that you can get done during your annual checkup in people. And I tell you that because I've been trying to get the colon cancer genetic blood test done, and the insurance refuses to do it. And you go, well, they have data on 200,000 patients, so that test works. Why would you not do that when the results are the same that a colonoscopy. But I think that at the last big cancer meeting in the U.S., the American Association of Clinical Oncology, the biggest thrust of the meeting was, does early diagnosis of cancer equal better prognosis? And believe it or not, in people, the answer as of now is we don't know. It does for some cancers, but not for others. And it is exactly the same thing in dogs. So, a lot of these tests will potentially diagnose cancer earlier on with all the psychological issues associated with it, but they may not really change a darn thing as to what happens, if and when you get treated. So I think that there's still a lot now. Now the National Cancer Institute just started a 14,000 patient prospective study looking at whether early diagnosis does indeed improve survival times and quality of life. So that is that it's funny because you always think early diagnosis is no brainer. You live longer. Well, not so.
Yeah.
You're starting to hear about the use that they may be able to use artificial intelligence working toward a cure of various cancers. Do you think that's equally true in veterinary medicine?
Yep. Yeah, I tell you, there's a lot of investment now in AI in veterinary medicine, and the common denominator as of now, at least for human medicine and the few papers that are out there in veterinary medicine, is that, for example, if you're looking at X-rays or mammograms or MRIs or CT scans, AI plus a radiologist is better than AI or a radiologist. So, usually it's a team situation, but that's coming. And, a lot of companies, I do consulting for IDEX laboratories, as I was mentioning before, and IDEX has a big AI program. And, when your dog gets lab work done or your cat gets lab work done, all this lab work, the results are in a cloud. They have a specific software that they use for that, and all of a sudden you will be looking at a patient's lab work, and AI will pop up and it will say, "This dog may have disease A, B, C, or D. Did you test for it?" And you go, "There's no way this dog has disease A, B, C, or D because everything looks good." And then you test them and you go, "Oops, yeah, they did." You know what I mean? So I think that is coming. So it's not going to take too long.
Well, that's great. Yeah. I mean, that, AI is a big, scary thing to a lot of people,
Mm-hmm.
but
Tell me
it may
about
be
it.
a lot, it may have its good impact as well. Let's shift gears a little bit and talk about the Greyhound Health Initiative. Mandy, you want to give us a little rundown of the history of its founding and so forth?
Well, actually, I will let Dr. Couto do that because he is the person who founded the Greyhound Health Initiative. So I
Yeah,
can,
I'll tell you, and then I'll pass the
yeah,
baton to Mandy. So
yeah.
what actually happened is, I retired from Ohio State in 2013, and we had this foundation where we would get, on the average, maybe $250,000 a year that we could redirect towards patient care and clinical research and whatnot. And I said, well, what am I going to do now? What is the Greyhound community going to do now? So I decided it's time to put together a not-for-profit organization. So, with a few people that, funny enough, they were all former clients of mine. They were families of some of my patients. We came up with this, and then we started with a goal that we were going to provide outreach, and that we really wanted to open a blood bank because there is a major need for blood. And then I'm going to let Mandy tell you a lot more about that. And then eventually, if things were right, we would actually be involved in clinical research. And we went through a few iterations. I very quickly realized that it's very, very difficult to run a not-for-profit only with volunteer folks. And then we restructured the situation, and that's I can't remember how many years after we started Mandy came on board. But then Mandy started helping out, and then she became la jefa, as we said before, because she's doing a great job, and we have a very, very functional blood bank, and Mandy can tell you all about that.
Mandy, but as we get into your involvement in the Greyhound Health Initiative, tell us a little bit about your Greyhound journey and when you got your first Greyhound and how that led to your involvement with the Greyhound Health Initiative.
Yeah, I actually became involved with the Greyhound Health Initiative before I got my first Greyhound. So I've been a veterinary technician since 2004, so about 21 years. That ages me. But I started at Riverside Animal Care Center in Dublin, and Dr. Couto used to come in there. So I met him through that animal hospital. He used to do consultations and things like that there. And also, one of my coworkers, Courtney, who happens to also be on the board for the Greyhound Health Initiative, and she was involved in a Greyhound adoption group in Columbus called Team Greyhound. So I got my first Greyhound in 2018. He was 4, and that's all it took, I guess. I'm completely in love with this breed. I learned so much about them back in 20. Let's see, it's 2015. I got asked to help start a blood bank at River. We were gonna have a space at Riverside Animal Care Center, but for the Greyhound Health Initiative. Courtney and I were going to help start this blood bank, and then some things fell through, and they needed somebody to actually run the blood bank and to start it from scratch. So Courtney and I did that. It was just the two of us for a couple of years, and now we have 5 employees. We have 2 satellite locations that we go and get blood donations at. And we have about 100 blood donors right now.
So is the blood bank? Is it in one physical location like a vet clinic, or what is it? What's the facility like?
Yeah, so we just lease a room actually, and so it's a large room that has a table in it and some equipment, a centrifuge. We have dog beds all over the place for the majority of our donors, our blood donors, especially at first, we're all Greyhounds. And now it's probably about 60% Greyhounds and 40% regular dogs. The Greyhound population has decreased significantly in the past few years in Columbus just because of the racetracks shutting down, and so we have lots of other dogs that give blood too, but there's a huge need for it. It's we have a 10 to 12 week waiting list for veterinarians to get these life-saving blood products that they need.
So how does that work? So this is the blood is for surgeries or transfusions where surgeries are necessary.
Yes.
And then it doesn't matter. You can go breed to breed, I take it. You can go from a Greyhound to a Terrier, for example.
Yeah, so they have dogs have blood types just like people do. They're not the same blood types as people, but they have blood types just like people do. And so we have universal blood type, which most Greyhounds have. We have a couple that do not have it, but the majority of Greyhounds have universal blood type, which means their blood can go to any dog that needs it. And then, we have some other dogs that have, we have a lot of pit bulls that have universal blood type as well. Other sight hounds that have universal blood type. And then we have this other type. We call them positive, DEA 1.1 positive, if you want to get technical. But because there's such a need for blood, the vet hospitals are also using a lot more of this other type of blood, which, when we first started out, it was very hard for us to find anybody to buy this type of blood. But now they're getting to the point where they're going to have to start buying it in order to keep up with demand.
Yeah,
So
and John, I was going to tell you that there are very, very few commercial blood banks in the U.S. in veterinary medicine,
Yes.
and there is a tremendous shortage because literally, I and this is my humble opinion, you cannot have a commercial blood bank that makes money without cutting corners with the blood donors. So it typically, when I was at Ohio State, we had a really big blood bank, and I think it's the same for us. Mandy has the numbers, but we do not make a profit. We actually every year we lose a little bit of money, and we balance that with donations and a number of other things. But it's it's an incredible hole that needs to be filled. And there's now different state regulations. In California, things are changing and blood banks are closing down. So what's happening is blood banks are closing down, but no new ones are opening up. So
how does it work with the relationship between the blood bank and the vet? Does the vet only make a request for blood when he or she knows he's got a patient that's going to have a transfusion, or do they get it ahead of time and kind of keep it in inventory?
So they have to get it ahead of time. They can't because we have this wait list for them to get it. They can't just wait until they need it. So it's mostly the emergency hospitals that will keep it on hand. But we ship out these orders all over the country. As far as California, we go as far as California, and all the way up in the Northeast to Florida. I mean, people, if we could, we would ship it out of the country, but we can't even keep up with what we have here. So
How is it stored chilled or frozen, or how is it
it depends
managed
on
in that
the,
way?
yeah, it depends on the product. So the packed red blood cells are one of the products that we get, and those have a 6-week shelf life in the refrigerator, and they have to be in the refrigerator. And then we have fresh frozen plasma, and that has to be in the freezer at a very, very low temperature.
Now, your
and
donor greyhounds, are they residents there at the blood bank, or they're
no.
normal pets that just get brought in on request?
Yeah, so they're all pets, and we let them choose. We let them choose whether they donate blood or not. We do not sedate them. We don't give them anything. We let them choose. So if they want to lay on the table and let us get their blood, then they do it. And they save lives. So one dog's donation can save up to 4 lives.
Wow. And
Yeah,
how often can a greyhound donate?
They can donate a lot more often than we take from them. 6 weeks, I think, would be the minimum, but we take them at 8. So every 8 weeks they come in, and they're scheduled, and they come in and they get their blood donation, and then they get to get junk food like we would for the Red Cross. We give them some junk food, and
yeah,
they love
good
it.
stuff.
They get to hang out with the other dogs. We have a room full of dogs all day long, and they sleep in their dog beds, and they get treats. And most of our donors get very, very excited. Like their owners cannot even hold them back. They jump all over us. They kiss us to death. They want to
Yeah.
be in our laps because they're so excited about their day at the blood
Yeah.
Yeah,
bank.
that is funny that you say that. So when we had the blood bank at Ohio State, there was a blood bank that had resident donors. So when I took over, the first thing I did is we had all the dogs adopted, and then we had sort of volunteer blood donors. Although
Mhm.
somebody told me the dog never signed anything. Mom and dad are the ones that volunteer them. But we made a video that is called "A Day in the Life of a Blood Donor," and
Mhm.
this is Luann. So Luann is an
Yes.
old client of mine, and she's always had greyhounds, and her greyhounds would literally drag her to the donation room, and she would always
Yeah.
go, "Well, why do they like this stuff?" And I go, "Well,
Right.
we pet them, we give them treats, and yeah, we poke them a little bit, but
Yeah.
I think they know what is going on." And a lot of the owners that investigate enrolling their dogs in a blood donor program are blood donors themselves, and they think
Yes.
that it's a great service for the community, and Mandy has organized a lot of joint events with the Red Cross, and she works quite a bit with the Red Cross. The Red Cross helps us out quite a bit with a lot of issues. So it's really a cool situation.
Yeah, we have a video actually on our website on the blood bank page that you can watch, and it's one of our donors that just gets so excited to come. And we've had people ask us, "Can you take a video or something of my dog? Because I just don't believe that they stay still,
Yeah.
for the 10 to 15 minutes." And we'll be like, "Yeah, sure." And so
Is that about the typical donation time?
yeah,
Once you've
about
got
10
the
to 15
catheter in,
minutes.
it's 15 minutes.
10 to, yeah, for a regular dog, it's about 10, but greyhounds have that thicker blood. So they take a little bit longer, but they just get loved on the whole time they're there, and they really, most of them enjoy it immensely.
Yeah, and I tell you, I have a collection of pictures of greyhounds doing the roach on the donation table. They
Yes.
finish donating, and they're like, they are in heaven. They're going like, this is cool.
Yeah, we've
So
had multiple dogs jump up on the table for us. And I mean, the table is incredibly high, and they'll just jump up on it because they're ready to get it done so they can get their junk food and go play with
In
their
addition to the satisfaction of having their greyhound donate, does the owner get any benefit? Not in a financial way. Well, maybe in a financial way, in the sense of a credit if their dog ever had to have a transfusion, that sort of thing.
Well, if their dog ever has to have a transfusion, they get free blood products. We would not charge them for that. We would give it to whatever hospital they were at for free. But they also get free heartworm and flea preventative every month because we want to keep them healthy. They get yearly blood work, yearly heartworm test, and annual exams. We work with 2 vet clinics that will give annual exams to our donors for free.
yeah, so these are several $100s a year
Yeah.
for a greyhound owner. Which
Yeah,
is
I
good.
looked at it.
It's a
It's
nice
probably
incentive.
about $1,100 a year in free products that they get for being blood donors a piece.
That's pretty good. That's a pretty good incentive.
Yep.
Yes.
Dr. Couto, what, in addition to most of them being universal blood types, what is it about greyhounds that makes their blood so desirable for transfusions?
Yeah, I tell you several things. So one of them, obviously, is the fact that we would always joke with the students. There is no way anybody can miss a jugular vein in a greyhound with a needle because it's like the size of a garden hose, right? So, and it lays right there under the skin. So that is easy. Second, their temperament, they're just cool. You put them on the table and they typically just stay there. Then we know that greyhounds have a slightly higher blood volume than other dogs, and they also have a higher red blood cell count than other dogs. So on a per unit basis, you end up giving them more red blood cells. And then serendipitously, we found out when we were looking at hemoglobin, that is the red blood cell pigment, is the pigment that makes the red blood cells stain red, actually, or look red. Their hemoglobin does a lot of magical things in sick dogs that it improves blood perfusion and circulation in the capillaries and in the heart muscle and a number of other things. So we learned that totally serendipitously. We were working with a fellow by the name of Andre Palmer at Ohio State, who is a chemical engineer that works only on hemoglobin in people. So we got him interested in greyhounds, and we did a lot of stuff. And we were like, he was going like, how come this dog's hemoglobin does that and other dogs don't? I go, well, they're greyhounds. That's always the answer.
What the Mandy referred to the thickness. I assume is that called viscosity in blood as
Right.
well as
That's a viscosity.
Yeah.
Yep.
what causes the higher viscosity in greyhound blood? Is it the red blood cell volume?
Primarily
The
the red
pack
blood
cell
cells. Yep.
volume.
Yeah.
Yeah.
Yeah. Yeah, and I tell you, and greyhounds have really thick blood. If you look at what we call the hematocrit, that is the percent of red blood cells in the total of blood. In a normal dog is 35 to 50. In greyhounds is 50 to 72. So they have a lot more red blood cells. And then we were jokingly talking about taking the spleen out. The spleen stores a lot of red blood cells.
Yeah, yeah.
And when they race and they shoot out of the gate, those red blood cells get thrown straight into the blood. So within literally 50 yards of starting, that hematocrit goes up to 80 to 84, which is really, really, really high. And that actually has a lot of beneficial effects. So, and just to give you an idea, when a dog has a red cell count or a hematocrit that high, blood will not go through a regular needle or catheter because it's just way too thick. You have to put like a big bore needle, so.
So is it, and this during the heavy exercise of, say, a race, so the viscosity of the blood at the end of the race will be considerably higher than it was at the start of the race or when he went
Right.
into the box.
Yeah, and interestingly enough, within an hour it's back to normal. And we did a couple of studies at the Wheeling racetrack, and the interesting thing is that when they shoot out of a gate, the viscosity of the blood almost doubles, and it's almost like honey. You can actually hear it coming through a thick needle when we're drawing the blood. It goes like, and that is the main reason why these guys have such a monstrous heart. The left side of a heart is like Popeye's biceps, all right? So they are
Yeah.
like pumping that blood out
Pump the
as
syrup.
fast as they can. And interestingly enough, thick blood actually improves oxygen delivery to the tissues because it opens up the capillaries. So the Greyhounds figured this out 10,000 years ago, that that's the way that we're going to do it. We're going to deliver more oxygen to the tissues by doing it in a non-conventional way.
What does it do if they have an injury that breaks the skin during heavy exercise, whether it's a race or running at home? Does the higher viscosity cause them to bleed more, less?
No, in theory, they should bleed less. We know that viscosity, if you have a dog that has some clotting issue and you give them red blood cells that increase their viscosity, they bleed a lot less. So we know that high viscosity tends to minimize bleeding. But greyhounds, talking about bleeding, as you well know, they do have this bizarre what we call delayed postoperative bleeding or delayed postoperative hemorrhage that is something that we spent a long time trying to figure out, and we finally did figure it out. So, and the one thing that I believe happens, to be honest, I don't have any data to show you, but a lot of greyhounds get what they used to call spinal cord thrombosis or fibrocartilaginous emboli, that they shoot out of the gate and then the rear legs stop working and they fall. And people thought that it was some bizarre thing. Well, what we discovered doing MRIs and a number of other things is that that is likely because their blood is so thick that it doesn't get to the spinal cord. There's a lot of balances that have to occur before blood gets into the spinal cord. So what we now know is that when they do that, we just put them on aspirin, that is a mild anticoagulant or blood thinner, and most of these dogs within a couple of days go back to normal. Whereas before, a lot of these dogs end up being euthanized. So
Yeah.
so that's a price they pay for having thick blood.
Yeah, I remember now that you mention it. I heard a talk of yours at a GPA convention one year, and I think you all had just discovered that at the time. That you said that if the dog develops some hindquarter paralysis, get an aspirin in them quickly.
Yep, yeah, and I thought it's interesting because if you think about, we were talking about the blood being so thick, people that have thick blood cannot really exercise very well because the blood will not go through the capillaries that are tiny little blood vessels in the muscle and the heart muscle and so on and so forth. So my belief is that over the 7 or 8 or 10,000 years that sighthounds have been evolved, they must have evolved the system that does not allow them to clot excessively. And that is the reason why they bleed after surgery, because that system, that is the clot busting system, kicks into overdrive, and then it eats away the clot, and now they start bleeding. So yeah, these guys are physiological marvels.
Yeah. What's the I'll stick on the bleeding subject, just one more question, and then we'll move on to a little bit more about the other work of the Greyhound Health Initiative. What is the relationship, if any, Dr. Couto, between the delayed bleeding syndrome and the von Willebrands?
Yeah,
It
no,
used to be thought that a lot of greyhounds had von Willebrands.
yeah, there was a lot of talk about primarily coming out of Pennsylvania. David Wolf and I have to tell you, I don't know how many thousands of greyhounds I tested for von Willebrand's, and I've seen 2 that were positive. So I ended up contacting the Cornell hemostasis lab, that is the one that ran all the tests for Dave. And I actually got all the reports from all the tests that were run for Dave that diagnosed von Willebrand's, and all the samples had broken red blood cells, what we call hemolysis. And when you don't have a good sample collection and you have red blood cells that break down, guess what? You test positive for von Willebrand. So I think that all his von Willebrand's dogs were a result of poor blood collection and processing. But like I said, I've seen 2 greyhounds with von Willebrand's, and I was like tickled pink because I at least had found one, and then I found another one. But it's not an issue in greyhounds. So the main issue with the greyhounds is that anytime you have surgery or you have trauma, the way you heal is you make a clot, and if that clot gets really big, then it will occlude the blood flow to perhaps an important organ that needs blood flow. So in order to prevent that from happening, this clot busting system that we call fibrinolysis kicks in, and it eats away the clot, but it doesn't eat away all the clot. It just like levels it off, so now the tissue can heal and everybody's happy. But I think that, as I was saying before, greyhounds probably evolved to have an overactive fibrinolytic system, and they pay the price after they have trauma or surgery. And now, Michael Cord at Washington State did some really, really good genetic studies looking at deerhounds, and now he's working on the greyhounds. But he did find the gene mutation that causes that, and at least in the first several greyhounds he has tested, it seems to pan out as well as it does in the deerhound. So, and now he has a study going on with Irish wolfhounds with Ann Fletcher at Cornell. So we know that these guys have an overactive clot busting system. We suspected that starting back like in 1988, give or take. So it's been a while, but yeah, it's the good news is that we can minimize or prevent that bleeding with specific drugs like aminocaproic acid or tranexamic acid, and that is actually probably our single most important contribution to minimizing mortality in greyhounds that underwent big surgeries. It was very, very common, and you may have been on the receiving end of this, but rear limb amputations in greyhounds are quite often completely covered with complications from the time you start a surgery until hopefully the patient goes back home. And one of the big ones is bleeding. And I can tell you, I was trying to remember the other day, but I think my record was on a beautiful bay girl from Michigan by the name of Belle. She got, I want to say 26 units of blood after amputation, and she just kept bleeding and bleeding and bleeding, and that's when I started looking at this aminocaproic acid, and then we discovered that it was literally like putting a cork in the bottle, in most of the dogs. So now is
that's the drug known as Amicar, I think.
Yep, that's right.
Yeah.
Yeah. So that's now standard of care. You should not do a big surgery in a greyhound without Amicar or tranexamic acid. So that actually made a big difference. So
do you give it to them prophylactically before the surgery, or only if you have the bleeding problem?
yeah, I tell you. So every medicine question, the answer starts with "it depends." All right. So it depends. If you just did a dental and you pulled a couple of teeth, I usually send them home with a prescription for the drug and tell the owners to watch them. If you did a small surgery, took out a small skin mass or something like that, I do the same thing. But any what I call big surgery, thorax, abdomen, amputation, cancer surgery, to me is malpractice to do it without aminocaproic acid.
Yeah. Well, Mandy, let's switch over to some of the other work that the Greyhound Health Initiative does in addition to blood-related work. Tell us about that.
Sure. So we do a lot of education. And so we are trying to do some webinars, some educational webinars during the year with people like Dr. Couto so that we can educate just owners, but not just owners, but veterinarians as well. A couple of our webinars from last year, Dr. Couto's webinar was called All Things Great, and Dr. Mason's webinar about osteosarcoma actually got continuing education credit for veterinarians and vet techs. So we were able to share that with, the veterinary community as well, and they can get, credit for that, for watching it and being educated about greyhounds. So we have we're going to try to have a couple more webinars this year. We're working on hopefully getting maybe a dental webinar because that's something that people are interested in with greyhounds and under anesthesia. There's always issues. So we are working on those things. We are also involved in quite a few research projects right now. We have two osteosarcoma research projects, both with University of Pennsylvania, one of which that we are supporting financially with donations, and they're both looking for samples, either samples of osteosarcoma or and then the metastatic osteosarcoma. They're actually looking for dogs to try a treatment option there at the University of Pennsylvania. So we also have two corn studies right now. We're still doing the corn paw pad study that we've been doing for years. That is with Dr. Doty and Dr. Mike Gilliard. And they are supposed to be wrapping that up this year, and we'll hopefully get an update on that study and what they found, looking for a genetic aspect of corns. And then the other study is in the United Kingdom. They're doing a study on tendonectomy surgeries and how they affect the dogs once they get those surgeries to help with to keep to get rid of the corn. They're having those surgeries
I can't pronounce that procedure myself. I've tried several times. Dr.
Yeah, I
Couto
know.
could probably
It's
give it a pretty
Yeah,
good shot.
they used to be the tenotomy.
yeah,
Tenotomy,
tenotomy or
O-T-O
tendinectomy.
means you cut, but tendinectomy means that you remove a piece of a tendon. Because what actually they found, and this is mainly Mike Gilliard, is that in a lot of the greyhounds, when you just did a tenotomy and you just cut the tendon will fuse again. So after several weeks, they will be back to square one. So what they do now is they remove a tiny little segment of that tendon, so that way they don't get back together.
Right.
Yeah. What and Manny, when you have these studies that the Greyhound Health Initiative
Yeah.
funds or sponsors or backs, do you then publish the study on the website?
Yes. So some of them we financially support, but then we also, the osteosarcoma study, we're actually helping them get samples and helping them get participants in their studies. And we did the same with the UK study. We have a couple of board members that are in the UK that will help us advertise things on social media, on our website, and so that we can help them get participants for the studies. We have such a huge Greyhound base that usually when we put the word out there that there is a study, they want to be involved in it. The osteosarcoma study that we're doing, we've received our 10th sample and now an 11th sample. 10 was their goal, and they're going to continue with it. And that PBS special is going to talk about a little bit about that study and the other studies that they're doing. But the National Cancer Institute, they presented that study to the National Cancer Institute a few weeks ago. And so they're very interested in it for human medicine, where there's a lot more sponsorship dollars that they
Yeah,
can.
and in this project, John, what they actually are doing at Dr. Mason's lab is we arrange for them to receive a piece of the osteosarcoma after the amputation, and then they extract the immune cells, the white blood cells that are called lymphocytes, that are actually targeting those cancer cells, and then they separate them, and then by a variety of different methods, they take, let's say, 100,000 cells, and they make 100 million cells, and then the goal is that once you do that, and those are CAR T cells, you give them back to the patient. So these cells are basically like a dog going after a specific bone. They're going to go straight after the osteosarcoma cells and hopefully get rid of them. And then the other project that we supported financially that should be near completion is a Cornell study generating normal blood values for Irish wolfhounds. So
Yes,
what we
I
call
have that on my
reference
list
intervals.
too.
So Dan Fletcher is one of our surgeons, and Dan is the guy that is working on the bleeding with Michael Court at Washington State. And they just sent me at least the preliminary data, and there's a lot of dogs. They have like 150 dogs, something along those lines. So that answers the second part of the question that you had. Is we will publish the results not only on the website, but the goal is to generate some peer review publications too. So.
Yeah, and probably also hopefully a blood value card, right? I think
Yep.
that was our goal is so we have blood value cards for greyhounds because they're different from other dogs, and we have those posted now in digital form. And you can buy the paper ones too. They're like little business cards, but we have it in digital form on our website now that anyone can access. And so we're hoping that once the Irish Wolfhound values are out, that we can do the same for them, and that way people can carry these in their wallet or on their phones, and they can show their veterinarians and educate them if
Yeah.
they don't know.
What sources of funding does the Greyhound Health Initiative have, other than the blood bank revenues?
Well, so the blood bank kind of has to take care of themselves. So all the money that we make off the sale of blood products goes back into the blood bank and buys things like their heartworm and flea preventative and the other things that we give them to keep them healthy. And so our revenue for GHI for these research projects is all donations.
And do you get grants from any governmental entities at all?
No, we haven't gone there yet. So too many
And
things
good
going
thing,
on.
because they think they
Yeah,
just
yeah, right.
eat.
What if somebody? So are these donations primarily from individuals?
Yes, yeah,
Yep.
they're mostly from individuals. We've had a few donations from adoption groups that that want to help us. We had a big donation for osteosarcoma research, and that's how we ended up being involved in Dr. Mason's research. Is that they were requesting that we use it for that, and so we went in search of who's doing this research and who could use our help, and so we send gift cards to the owners whose dogs participate in that study to help them pay for a histopath, or it's not a lot, but it's something just to thank them for participating in that study.
Yeah, Nathan, and we have people that donate $10, and we had people that donate $50,000. So
Yeah.
it's been people have been very generous.
Well,
Yes.
if somebody wants to donate to the GHI, how do they do it?
So they can visit our webpage. We have a donate page on our webpage. There's a little donate button on our webpage, ghi.vet. We have PayPal too. We can do that, and we're also on the Facebook donation. There's a donate button on Facebook as well.
GHI is a 501c3 charitable
Yes.
institution with tax-deductible donations, I trust.
Yep,
Yes.
that's right.
Yes, we are.
Now, what if we hear from time to time about somebody's got a greyhound with osteosarcoma or some other cancer, and they are in the process of figuring out which way they want to go, and they want to get in touch with Greyhound Health Initiative and or Dr. Couto. How's that done? What's the protocol for that? What's the actual
Yeah, couple of
channeling?
different ways. One of them is they can go on the GHI website and inquire. I do a lot of consults for sighthound owners, families, adopters, et cetera, and they can go to my website and request it through there. But it can go through either one, and my website is cotovetconsultants.com. But I do lots. Actually, that is one of the, I hate to say, good things about the osteosarcoma issue in greyhounds, that for all these projects, I get lots of consults every year. I get literally at least one consult a week on a greyhound with osteosarcoma. So that generates a lot of samples that hopefully will eventually generate a lot of answers, I hope.
Yeah. And then
And Dr. Couto, are you typically consulting with the greyhound owner or the vet, the owner's vet?
In the ideal scenario, the vet should be involved. And, I don't know if you know about the veterinary patient relationship, but in order for you to make treatment recommendations, you must have seen that patient personally or via telemedicine. So, what I typically do is if a family contacts me, I ask them for their veterinarian's email address, and then I email both of them, and I basically relay all the technical stuff to the vet and the not non-technical stuff to the family. So that's oftentimes I get consults initiated by the veterinarian. So then I CC the family so they know what we're all talking about.
Yeah. Mandy, what's the website for the Greyhound Health Initiative?
GHI.vet.
Oh, that's easy enough.
Or
Very
if you
good.
put in greyhoundhealthinitiative.org, you'll get there too. But GHI.vet
Yeah.
is easier to remember. So we have an educational resources page that we've worked really hard on. It's fairly new. There's a search bar, there's tags that you can search for. So if you put in osteosarcoma in the search bar, you're going to get all the resources we have on osteosarcoma pop up. Same with corns. We have a lot of resources on both of those subjects because of the things that most greyhound owners have to deal with. And so,
yeah. What's the future of the GHI? When Dr. Couto decides to hang it up, I'm going to play with my grandchildren all the time. What does the GHI go forward from there?
Very good question. To be honest, we hadn't addressed that yet, and don't forget that technically I am retired. I have technically been retired for 13 years or something like that, but
right.
but that did not work out that well. But yeah, I don't know. And it's disappointing that I could never find somebody who was so passionate about learning about greyhound medicine as I was. And there's still a lot of vets out there that know their greyhound stuff, but I don't know. When things happen and either my body goes or my brain goes, I think that there go the greyhounds. So I don't know.
Well, we hope not. We hope that's a long time in the future.
Yeah, you never know.
Exactly.
But GHI will continue to do a lot of the good stuff without me.
I mean, as long as there's greyhounds, I feel like we will be around, and I can't see that breed is ever going to go away. We love them too much.
Yeah, and Mandy, you mentioned the shortage. I don't think that's going to be very very long lived. With the international programs coming in, I think you'll have plenty for the blood bank and so forth.
Yeah, we're getting some. We have a couple of Irish greyhounds that are part of our blood donor program now, and so we're starting to see some of the adoption groups get dogs from other countries, and they're interesting because they're their personalities are a little bit different.
Oh yeah.
And so it makes you think, well, if their personalities are different, then their medical issues might be a
Yeah.
little different. And
Yeah,
so
that's going to be an interesting subject for a
yeah,
future conversation, is whether
Yep.
these, they're all from the way back in the pedigrees from the same bloodlines, but there's been a lot of, different breeding done. And so it'll be interesting to see whether Australian Greyhounds have different lab values from Irish
right.
Greyhounds and
Yep.
from
Yep.
British Greyhounds and so forth.
Yeah, and it's interesting because years and years ago, with Sara Saldiva and Liliana Marin, that were my grad students, we never published it, but we did a really good study where we compared the incidence of different diseases in former racing greyhounds, AKC greyhounds, and galgos living in the U.S. And it was like if you were looking at three totally different breeds, like if you were looking
Mhm.
at poodles, cockers, and rotties. I mean, like
Right.
totally different everything,
Yeah,
So.
yeah, absolutely. Well, folks, it's been a fascinating conversation. We certainly appreciate your time. You're both busy, got a lot going on, so we appreciate your making the time for us.
No, thanks for having
Yeah,
us. This
thanks
was
for
fun.
inviting
So,
us. Yeah.
We hope the GHI continues for a long time, and Dr. Couto keeps playing with greyhounds in addition to playing with his grandchildren. So
I will. Yeah,
Right.
that's great. Thanks,
thanks
John.
again, and Greyhound lovers, join us for the next episode of the Greyhound Nation.
Thanks so much for listening to the show. If you're not a regular listener, be sure to follow Greyhound Nation wherever you get your podcasts. We're also on social media, Facebook and Instagram. Just search for Grey Nation Show, follow us, and you'll get notifications every time we release a new episode. You can also get new show notifications when you subscribe to our YouTube channel. If you like the episode, leave us a review on our Facebook page or your favorite podcast app. You can also send us feedback or questions via the contact form on our website at greyhoundnation.dog. That's greyhoundnation.dog. This episode was produced in collaboration with host John Parker. Our theme music was composed and performed by Dimitri Taras. It was a great treat to have Dr. Couto and Mandy Albert on this episode. You can keep learning by visiting ghi.vet for the Greyhound Health Initiative website. If your greyhound needs a specialty care consult, consider reaching out to Dr. Couto via coutovetconsultants.com. Other links for donations and the Greyhound Health Initiative video archive are available in our full show notes. I'm Michael Burns, and you've been listening to Greyhound Nation.